I started looking at respect for others and the environment. And then I started looking at other problems in higher education, because I knew that we would strengthen our case for a tobacco-free campus or a smoke-free campus if we could attach the policy's adoption and implementation process to helping us with other issues on our campus. Bingo! Jackpot! Because what are the big problems facing us in higher education with students? How about behavior in the classroom, whether it's seated or web-based? Inappropriate behavior. How about that problem? We got issues, don't we? And it's a respect-based problem, is it not? Basically. When individuals engage in behavior that is inappropriate towards other people, whether it's student on instructor, or dare we say teacher on student, staff member on student, staff member on staff member, all of those kinds of inappropriate behaviors are a function of lack of respect at their heart. And we can say, well, that's a parental responsibility, that's not our responsibility in higher ed. We can say that. But what if we could elevate the importance of respect? What if we could teach more about the importance of respect? What if we could use a tobacco-free or smoke-free campus policy to start broadening the discussion on our campus about respecting others and attach it to our commitment on our campus to greening and sustainability and talk about not only respecting others, but respecting the environment? Doesn't that take away from some of the onerous notions about repressive policies against tobacco users and smokers? Doesn't that do that? Rock and roll, it does. You better believe it. And you know it. You know it. But we don't normally think about articulating tobacco policy or smoking policy in terms of respect for others and the environment. We talk about protecting people's health. And here's what I say to that. That's a very, very important thing to talk about, but I view it as an added advantage of making the campus tobacco-free. I like to say it this way. Make your campus tobacco-free out of respect for others and the environment. And you know what? If one person quits smoking as a result of this policy, all other things being equal, that person's life has been extended. Hallelujah. How many policies will we pass at our institution that will have that as an added benefit? How many? Very few. See how that works. And we know this. The Centers for Disease Control tell us that among a broad age range of people who are smokers, that is to say people from the 20s on up to, or even upper teens on up to my age or older, we know that in that broad range of people, anywhere from 75 to 80% say they would like to quit using. They'd like to quit smoking because it's primarily aimed at smokers. So what will the policy help us do with our staff, our full-time employees who are on the campus 8 hours a day, 5 days a week? It'll give them a way to maybe help move them to something that they would like to do. Many of them. Yes, sir.
Perhaps what we could do is tie that respect into things like spitting on campus.
Absolutely.
And covering your mouth and your nose when you cough or sneeze. And most interesting on our campus, which I've noticed, because I've been on other campuses for a while, washing your hands after going to the bathroom. Mm-hmm. Some people truly surprise me on our campus. I know them, and I watch them in the men's room. They wash their hands before they go to the bathroom, but not after. Yeah. So there's a certain level of respect there that's sort of the opposite of what was normal.
And that Bob, that's a great point. There are lots of tangential issues that are respect related, but I'll tell you one that's even more powerful than that, although that's a very powerful one. How about the number one problem in higher education? Number one. Funding. Well, from the funding for sure, but from the perspective of the student and the process of higher education itself. Not the external trappings, not the funding issues, but from what occurs in the process of higher education. I submit to you that the number one problem is academic dishonesty. I submit to you this is rampant. And I don't have to submit that to you. It's in the literature. Everybody's talking about that. Most of your campuses have some kind of a task force looking into how to deal with cheating, how to deal with plagiarism, how to deal with academic dishonesty. All of those issues are at their heart a function of lack of respect for the learning process. So if we really want to take on this issue from a respect point of view and elevate the importance of respect on our campus, look what we can do. Look what it lets us do. It lets us get at a whole bunch of issues besides tobacco use. That is the power of the rationale for the policy being thought through and talked about and used as a means to bring about an enforceable, supportable policy across your institution. I've talked with many faculty groups. I've talked with directors of nursing about this on medical center staffs. Because I talk to these people about when they're so reluctant, they're so concerned about their staff being expected to support or them being expected to support a policy of this type. It's not their job. It's not my issue. And I will say, among the faculty, I'll say, well, let's talk about the problems that you are encountering as a faculty member. How about cheating? Is that a problem for you? Well, yeah. How about getting people to not text in class? Oh, yeah. How about people speaking out of turn or when they don't have the floor, or having sidebar conversations when you're trying to lecture? How about those problems? How about bullying? There isn't a faculty member that you can talk to that doesn't confront those problems on a day-to-day basis. So if you say to them, let's try to look at, forget about tobacco for a minute, let's look at just elevating respect for others and letting you be able to see how you can then use that in the classroom to help strengthen and improve the quality of the learning experience in your classroom, whether it's seated or web-based, I think you'll find a lot of people will agree with you. And when I talk to directors of nursing about it, I talk with them about how to teach their nursing staff to engage in conversation with patients about, or visitors about, a smoke-free or tobacco-free campus policy on the hospital. See, hospital people, like educators, like to have signs up. That frees us up from having to talk about it. Gives me permission not to have to say a damn thing. There's a sign over here. That says it all. I'm not big on signs. It's visual noise. There's too much of it. I'll tell you an example. I went to a hospital in Alabama. Marshall Medical Centers. Boaz, Alabama is the main hospital, and then there's another one in a little town nearby. And then there's like 30 other residential structures that have something to do with the hospital. There may be imaging in one building, and they're tobacco-free, or wanting to be tobacco-free. They've actually had a policy implemented.